Hi, everyone. Welcome in. I'm just going to give it a minute or so for all the participants to filter in, and then we can get started. Can you guys just confirm quickly that you can hear me? Okay. Awesome. Exciting. This chat is really going off, but I love that. It's going to be a fun group. Yes. Happy Wednesday. Good afternoon or good morning, depending on where you are. Ooh, okay. I'm seeing that there's an echo. Katie, any thoughts? Or Katie, do you hear the echo?
I don't hear the echo. It might just be depending on how people are joining. They might, if they're, especially if you're joining by phone, sometimes if you have two things with sound, you'll hear an echo. But as far as I can hear, you sound perfect.
Thank you. Yeah, I'm getting some confirmations of no echo as well in the chat. All right. And then you all should be able to see my screen. And I'm hoping, yes, awesome. Okay, let's get started then. It looks like our participants are starting to, the count is starting to slow down. So I think most people are here. And put up the screen. Okay, awesome. Hello, everyone. Happy Wednesday. Welcome to the Women's Pelvic Health webinar hosted by Hinge Health. Today, we are going through a lot. We are answering your biggest questions about your pelvic floor, what it is, and how you can take care of it, and more. My name is Dr. Lakshmi. I am a PT as well as a consultant here at Hinge Health. I've been with Hinge Health for about a year and a half, but I've been practicing physical therapy since 2019. And I've had the pleasure of treating many people who have pelvic health dysfunctions through a virtual setting here at Hinge Health. So very excited to not only talk to you about pelvic health, but also what we can do for you here at Hinge Health. Um, like I said, we are talking all things pelvic health today. So many women experience symptoms of pelvic floor dysfunction. We call that PFD for years without even realizing that exercise therapy can help. And despite its prevalence, there are still a lot of misconceptions and stigma around pelvic health. And I think because of this, a lot of women don't ever seek care for it. We just assume that it is a normal part of aging or it's normal after you give birth to have these type of issues. And even those that do seek care tend to do so on average 6.5 years after symptoms begin, which is quite a long time to be dealing with symptoms on your own. And at Hinge Health, we have responded to this care gap by launching America's first nationally accessible women's pelvic health program. And as with all Hinge Health programs, if you're not familiar, members are supported by a complete care team, and that includes a women's health coach as well as a pelvic floor PT. And we are typically available for next day appointments and sometimes same day as well. So we'll talk more about that later. Today's agenda, we are covering what is pelvic health, what is your pelvic floor, what are its functions, what does dysfunction look like, what is pelvic floor PT, why you should see a pelvic floor PT, and then we're actually going to end on the actionable if you are ready to take the next step and get started. We will talk about how to do that as well. Any questions that you all have, feel free to pop them in the chat, and then either Katie will answer them if they are non-clinical, and if they are clinical, then we will try to get to that at the end of the webinar. All right, let's get into it. So what exactly is pelvic health? It refers to the well-being and proper functioning of your pelvic region. This includes muscles, ligaments, and organs that are located in the pelvis. And maintaining good pelvic health is important for overall wellness, just like maintaining any other part of your body is important. Now, if you're looking at this picture, think about if you're looking at a person that's right in front of you and you kind of cut them in half and you're looking over. That is what the image there is. Your pelvic floor is made up of layers of muscles and ligaments that stretch from your pubic bone in the front all the way to your tailbone in the back. So it makes kind of like a bowl-like structure. And they do some of the most important functions for your body. So we call these the 5 S's. So number one, like I said, if you think about like a bowl shape, it supports your organs above it, like your bladder and your uterus. So if you've ever known someone that had a weak pelvic floor and had a prolapse, then that bowl is no longer so supportive that you start to have organs coming through the openings. Second is sphincteric, right? Just means that your pelvic floor muscles contract and relax to empty your bowel and bladder when the time is right, or hold it in when the time is not right. Third is sexual function. So it should be able to relax to make sex comfortable, but also contract for orgasm. And then stability. We'll talk about this a little bit more later, but the pelvic floor actually supports your spine and hips and is a part of your core, technically. And so we all know the core is important for stability. And then last, it acts as a sump pump. And this is just a fancy way of saying that it helps with circulation. So when you have blood that's pooling in your lower extremities or your legs, then it helps kind of bring that back up to the heart. So these are the functions. Let's talk about dysfunction. Now, when your pelvic floor muscles are strong and they're healthy and they're functioning correctly, a lot of us are not really aware of its existence, which is okay. But when something is not functioning well, that is typically when our attention is peaked, and we refer to these as pelvic floor disorders or dysfunctions. And like any other muscle in your body, it can become tight, it can become weak, painful, less supportive, etc. Now, these disorders can occur at really any stage in someone's life, whether you have given birth or you have not given birth. But we find that the most common life stages in which we see an uptick in pelvic floor symptoms are pregnancy, postpartum, and menopause. I do want to caveat here that even if you are not in one of these stages and you have symptoms of a pelvic floor disorder, you should still 100% seek care and talk about it. So if this sounds familiar, you're not alone. As you can see by the statistics on the screen, quite eye-opening, at least for me, that pelvic floor disorders are really that common. Nearly a third of women have a pelvic floor disorder or will have it at some point in their lifetime. And if you take nothing else away from today's workshop, except for one thing, remember this, that common does not mean normal. And I like to use the example of diabetes because I think it's a little bit more universal and relatable, where so many people in our society get that diagnosis of diabetes. But once you get that diagnosis, it's not like you're like, okay, I guess that's it, and you forget about it, right? Typically, we then take a lot of steps to seek care. Maybe we have to take medication, maybe we have to make lifestyle changes. The same goes for pelvic floor disorders. Why then do we as women decide to keep quiet and just accept it as a part of our life and not seek care for that? So I think it is time that we speak up, and I am a very strong advocate of this, but I would love for you all to hear from a member that has done the Hinge Health Women's Pelvic Health program, and her name is Margaret. So I am going to attempt to play this very quick video, and let's see if it works.
Pregnancy was hard. I won't lie about that. I wasn't able to do a lot of what I love to do anymore. I was diagnosed with rectocele. It's a prolapse of your rectum. Awesome. My doctor didn't tell me anything. It'll go away. That's literally what she told me. If you're looking at going to a PT, you're looking at business hours 8 to 5. Being a new mom, you can't really fit that into your schedule. I had like a mental breakdown. I felt like a prisoner in my own house. I know that so many women are experiencing this. There's others out there like me. It's time that women start speaking up about pelvic health issues. If I can help at least one person, that lived experience is worth it.
Awesome. I'm glad that video worked on the first try. So if you're thinking about pursuing pelvic floor PT like Margaret did, I think this section is very applicable to you. Now, pelvic floor PT, what is it? It's a specialized branch of PT that focuses specifically on the muscles of the pelvic floor. And because it's so specialized, it can often be really hard to find a pelvic floor PT. And when you do find one, it can be really hard to find appointments and have access to one. So we are really fortunate here at Hinge Health to have such a robust clinical staff to support these women with next day availability, sometimes as early as same day availability. And now meeting with your pelvic health PT obviously involves a very holistic approach to treat these type of symptoms. We treat through education about pelvic anatomy and function, so you're more comfortable with your body. And I think that tends to reduce some fear and anxiety as well. We do training in behavioral and lifestyle strategies that affect pelvic floor function, healthy bathroom habits, nutrition, all the works. And then we also obviously do movement and exercises that target the muscles of the pelvic floor and other connected structures. We will talk a little bit about that later as well. And in some cases, we also do biofeedback training using a Kegel trainer if appropriate, which is a device that you can insert and it can actually read your pelvic floor contractions. So very cool stuff. Now, some of the most common conditions that we see are on the screen here. Urinary leakage, especially with coughing or running or sneezing or jumping. We see that very often. Pelvic pain, including pain with intercourse. I know that sometimes that can be a really touchy subject for people, but again, we want you to be comfortable and bring up anything that is relevant that you're experiencing. Pelvic organ prolapse, constipation, and bowel dysfunction. I think a lot of people are actually surprised when we mention that one. And then just general pelvic floor muscle tightness or weakness. So when getting care for pelvic floor, seeing a specialist is really important, and all of our Hinge Health pelvic floor PTs have advanced training and clinical experience in the assessment and treatment of pelvic floor conditions. Just as importantly, we know how personal this care can feel, and so we work really hard to create a respectful, professional, and judgment-free environment, and we are all trauma-informed PTs for those of you that have a little bit more complex situations. If you have any of the symptoms that I listed and you are considering the Hinge Health pelvic floor program, here is generally what you can expect. Again, your pelvic floor PT will make you as comfortable as possible. And then we will do a detailed interview kind of regarding what symptoms you're experiencing, your background, anything that may be relevant. We will observe movement and breathing patterns just as you would in a traditional PT setting. And yes, we can do that virtually. It just looks a little bit different. We will examine all relevant factors, dietary habits, stress levels, anything lifestyle related that can be helpful. And the biggest piece is that all of this is done conveniently through the Hinge Health app on your phone. And I think having everything in one place where you can do movement assessments, you can read educational articles, you have your exercises, you can do a video visit with your PT or health coach, or you can just message them. It is very easy to integrate this type of intervention or change into your lifestyle. So, how do you know if you could benefit from pelvic floor PT? If you answer yes to any of these questions or statements, you would be a great candidate for the Hinge Health women's pelvic health program. We do a lot of personalization. So even if you have something related that's not on this screen, I would still urge you to sign up and talk to a PT to see what we can do for you. And our ability to personalize is very high, especially being virtual and with the program that we have. So don't ever feel shy or hesitant to ask your questions. So you might be wondering what kind of exercises are included in your program, and I can tell you it definitely goes way beyond Kegels. I know Kegels are the famous exercise for women's pelvic health, but it is really important to focus on full body strength and mobility to achieve optimal pelvic health. I already saw a couple people in the chat when I played that video mentioning low back pain or hip pain or sciatica symptoms. And so it's quite common that you have other issues going on at the same time and that they are related. Sometimes they're not related, but a lot of times they are. And anytime you go see a PT, if you go see a PT for knee pain, you're usually not just targeting the knee. You're looking at the joint above and below because your muscles don't work in isolation. They work in conjunction with other parts of your body. Same goes for pelvic floor. And depending on your unique situation, you may need a different ratio of strengthening to mobility and flexibility exercises. So your pelvic floor PT will talk to you about what your unique needs are and then develop your program accordingly. Okay, let's try, since we're all here, let's try some breathing exercises. And for those of you that don't know, diaphragmatic breathing, also known as belly breathing, allows your pelvic floor to relax and stretch, which helps muscles stay strong and flexible. A lot of us, if we have quick and shallow breathing, especially in times of stress, it prevents your pelvic floor from fully relaxing, which can lead to a lot of dysfunction. And I mentioned earlier, the pelvic floor is part of your core. So when you think of your core, think of it as almost a box, right? So you have your diaphragm at the top, and then you have your abs in the front, and then you have your spinal muscles in the back, and then your pelvic floor is the bottom of that box. And when you are belly breathing or diaphragmatically breathing, the kind of what's going on is when you inhale, your lungs expand to take in all of that air. And because they're expanding, the diaphragm actually moves down to create space for that expansion. When the diaphragm moves down, your pelvic floor should also relax and move down. And so that is inhaling. And then when you exhale and that air is expelled, right, your lungs then constrict a little bit. The diaphragm comes back up, and so should the pelvic floor. So the box should be moving in unison is the idea. So let's try it. If you are either sitting upright in a chair, you can stay right there. If you want to try laying on your back with your feet flat and your knees bent, you can try it that way. To inhale, you're going to have one hand on your chest and one hand on your stomach. And you're going to breathe in slowly through your nose, counting to 5 as you inhale. When you're doing this, you should feel your chest and your stomach expanding up and out into your hands. Your stomach should move out further than your chest, and you should have minimal movement in the neck and the head. As you exhale, relax your jaw and breathe out through your mouth. Exhale slowly, count to 5. If you can't do 5, you can pick another number. And you should feel everything deflating, specifically your chest and your stomach, back to its original position. Okay, so try that a couple times. You would think something as simple as breathing is something we all have down, but it's not always taught to us and we're not always aware of it. And so habits can change over time, and so can how your body functions or adapts. So this is something I think is really important, and it's very simple that you can implement it throughout your day. But if you have more questions on this, your pelvic health PT can always talk to you on how to do this properly and how to integrate it into your day. All right. And then touching on how to sign up for Hinge Health. So we offer a complete pelvic health pathway that you can do on your own time without leaving home. And many of you attending today's webinar should have access to Hinge Health as a benefit. So if you're insured through your employer and your employer is a client, then this is free of cost to you. So signing up is really easy. You can scan the QR code on the screen, or I'm going to put in the chat the link that you can just click on, or copy and paste maybe, because I don't know if that is clickable, and sign up right there. Again, I think one of the biggest benefits to Hinge Health is one, that it's free. So it's really not costing you anything other than your time. And even with that, the convenience of having a PT in your pocket is just immeasurable, simply because you're not having to wait to go get into the clinic to ask questions. I get patients in real time saying like, hey, this happened yesterday, what's going on, or what can I do, or hey, I'm in a little bit more pain because of this, or this went really well, and we can kind of chat back and forth. So it's, to me, really nice to be able to have that immediate connection, as well as all the other benefits that we talked about. But yeah, that kind of concludes the information portion of the webinar, and I will take any questions that may have come up in the chat. Let's see, Katie.
Yes, I'm going to answer. Just somebody asked me a question privately. I'm going to respond to them in the chat, and then I will pull up some of the questions that have come up that I wasn't able to answer because they're more clinical in nature. So give me 1 second here.
Yeah.
Um, okay. Okay, perfect. All right. So actually let me come on camera here. Here we go. Perfect. So one question that I saw that I thought was really interesting is how soon after a hysterectomy should someone start pelvic floor physical therapy? Is there like a magic time to start?
This is really dependent on what your doctor tells you. So some people can start sooner than later, but I think it's still helpful to get in even informationally, right? So if you're not ready to start exercises, there's still a lot of reading and informing your PT that you can do to help prep, and then also to kind of work on lifestyle or habit modifications during that period where you're not supposed to be doing a lot of exercise.
Great question. There's a couple of kind of intimacy related questions that I thought were interesting. One was, does pelvic health have anything to do with libido? And can pelvic floor issues cause certain sensations during sex? So like a tearing sensation or like a painful sensation.
Yes.
Is that all connected?
Yeah, so pelvic health is definitely connected to both libido and sensations during sex. Dyspareunia is actually something very common. It's pain with intercourse, and we see that quite frequently, which is why I say it can be a kind of a touchy topic or awkward to talk about. But we do go over various sex positions that can be helpful for certain people if they're having a lot of difficulty, how to relax the pelvic floor, et cetera, and how to work with your partner too. So there's a lot that can be done there. In terms of libido, it can help contribute if there are issues that are associated with low libido. But if there's something hormonal going on, then you likely are going to have additional intervention, such as medication or something that a doctor, like a medical doctor, could provide.
Perfect. Can sports like cycling or horseback riding affect your pelvic floor? I thought that was a really cool question.
That is a really cool question. It can affect your pelvic floor just because it is more of like a high intensity sport, or there's just a lot of pressure on the pelvic floor. But it's kind of like correlation doesn't equal causation, right? Just because you do those sports does not mean that you're going to have a pelvic floor dysfunction. But if you do have a pelvic floor dysfunction and you do a lot of those type of sports, there may be some more work that needs to be done on dosage, and then strengthening specifically to train for that type of intensity.
Great. I see a couple of questions here that are kind of coming up more that are more program based. If you are insured under Medicare Advantage, are you eligible? The answer is it depends on your plan. The best thing to do is to go to the website and type in your particular plan, and it'll tell you if you're eligible or not. We have, I think, 500 different plans and companies represented here. So I'm not an expert on all of them, but kind of all your questions in terms of eligibility will be answered by the website. So would recommend going there. Let's see. I see a question. Is pelvic floor therapy still effective even if you gave birth 3 years ago? I've heard this question a lot, and the answer is yes. You don't have to be a brand new mom. You can join kind of at any time because we know these issues can occur for years after. A question about diastasis recti. I know that that's a big one. We can help kind of get those muscles back into place. So that is absolutely something that we can address in the pelvic floor program. Let's see, I see a question about prolapse and that their doctor said that they're going to have to do exercises the rest of their life. And if they keep up with their pelvic floor exercises, could they potentially avoid a pelvic floor surgery? So I think that's a great question for you, Lakshmi.
Yeah, 100%. It depends on where, like what level of prolapse that is. Some people have a more severe prolapse where they will need surgery. Others have a little bit of a prolapse where if we can kind of maintain and strengthen, then it's not going to progress to where you would need surgery. So highly dependent, but definitely would strongly, strongly recommend PT, whether you are planning to get a surgery for prolapse or not, because the surgery essentially is kind of a band-aid, right? Like it put something there to help support, but the weakness is still there. So you can still have other types of symptoms.
Perfect. Thank you so much. I see a question PT can help with lichen sclerosis. I know with specific conditions, that's one of the things where when you fill out the application, if you note that you have that, we'll be able to route that to a PT that knows all about that condition and can kind of recommend to you. So just for the purposes of this webinar, I don't want to go too deep into medical advice, but if you have a specific condition like that, please do indicate it when you sign up for the program because it'll help us. It'll help us get you to the right place.
Yeah, and speaking on that also, my suggestion would be sign up for the program. And then once you do speak to your PT, you can give those specifics. And if for whatever reason that specific program is not appropriate and a different program is, we can very easily switch you from one program to another. Same thing if you have multiple issues going on, like something in pelvic health versus something musculoskeletal. We are really flexible. So don't worry about, oh, whatever I start in is whatever I end in.
Absolutely. Absolutely. If someone's already doing PT with Hinge Health, can they add the pelvic floor? The answer is yes. Kind of what you were just saying, Lakshmi. If pelvic floor is your main concern, we recommend signing up for the pelvic floor program. But if your main concern is something else and you want to add in pelvic exercises, you can absolutely do that. So it's kind of dealer's choice based on how severe your symptoms are and what you want to focus on. Do you recommend starting pelvic floor exercises while pregnant or postpartum? I think the answer is both and really just depends on your
100%.
situation.
Yeah, that's another one. I think that a lot of people are misinformed or just uninformed, that there is no danger to doing exercise while pregnant or prior to or after. It just depends on, again, your unique situation, what is appropriate at that time, but there's always something that is appropriate. So again, I would recommend being proactive and advocating for yourself in that.
Absolutely. Let's see. Can endometriosis affect the pelvic floor and manifest as IBS type symptoms? That's an interesting one.
That is an interesting question. It can manifest as IBS type symptoms. That I would definitely check with your doctor to confirm what is what. But they're definitely related and can contribute to pelvic pain if you have endometriosis. So that is definitely something that we will talk about a lot with our women's pelvic health patients and how to manage that.
Awesome. Okay, I think we have time for one more question before we have to log off. But can pelvic floor issues be tied to your menstrual cycle? Can they get worse during certain times?
100%. That is another thing that we commonly see. Actually, I have quite a few patients that tend to have a lot more pelvic pain or back pain around their time of like the month. And that is strategies that we can work with to help relax the pelvic floor, to help deal with just general pelvic pain, or if you're having a lot of dryness around that time. So, another good point to bring up. So thank you for asking that question.
All right. Well, that is our time for today. We tried our best to answer as many questions as we could, but again, completely recommend if you have any kind of specific questions, fill out the application, talk to your PT, and we'll get you the answers you need. We did record the session, so we'll send you the recording tomorrow. It'll be uploaded online, so you can go back and view it too at any time as well. But thank you so much, everybody. Thank you for the great questions, the great conversation, and thank you, Lakshmi, for the great content. This was an awesome session. So thank you so much, everybody. We will see you soon.
Thank you.
Bye.